Hi friends, we had already seen the anti-hypertensive drugs, anti-anginal drugs, drug used against congestive heart failure already. So we are now discussing the drugs which are used against the arrhythmia, that is anti-arrhythmic drugs. The anti-arrhythmic drugs are classified onto the four classes, that is class 1, class 2, class 3 and class 4. These are the four classes which are used against the disease arrhythmia. The first class, as you can see on the screen, that is the first class is sodium channel blocker. The example of the sodium channel blocker are quinidine, lignocaine, propafenone. The second class is beta blocker. The example of the beta blockers are propranolol, timolol, ismolol and atenolol. The class 3, that is the drug that potentiate or prolong the duration of action potential. We have to increase the action potential in the duration of the action potential in the disease arrhythmia, because the time of the every action potential is very less. That's why arrhythmia occurs. So we have to increase our ultimate aim is to increase the duration of the action potential. So the third drug is the drug that potentiate or prolong the duration of the action potential. The example of this is aminodacron. Then the class 4th are the calcium channel blocker, and the example of the calcium channel blockers are verapamil, diltiazem, nifedipine and amlodipine. So these are the four classes of the drugs which we can use against the arrhythmia. Now let's discuss each class one by one. The first class, that is sodium channel blocker. Examples are quinidine, lignocaine and propafenone. The mechanism of action of sodium channel blocker is such that blockage of the sodium channel shows upstroke of the action potential. Action potential का upstroke होगा, that will slows the conduction and that will prolong the QRS interval in the ECG. That is by one method. The second one, that it can prolong the action potential duration by blockage of the potassium channel, that it will block the potassium channel and that will leads to the prolongation of the action potential duration. This is the second way. And the third way by which it can be useful is such that it will have direct action on the SA node and the AV node both. By this mechanism, the sodium channel blockers will help in the disease antiarrhythmia. Now the second class, that is class 2 beta blockers. The examples of the beta blocker are propranolol, timolol, ismolol, atenolol. Okay. The mechanism of action of the beta blocker is such that it will decrease the phase 4 depolarization. So we have seen that action potential have first phase, second phase, third phase and fourth phase. Such in that action potential graph, the beta blocker will decrease the phase 4 depolarization. By decreasing the phase 4 depolarization, it will decrease the automaticity in the SA node, that will prolong the refractory period and that will decrease the conduction velocity. That's our aim. So this beta blocker is used in the treatment of pre-entrant arrhythmia involving the SA node or to control the ventricular rate in atrial flutters and fibrillation like condition. Also, this is the use of the beta blocker. The last one is the sometime MCQ can be asked from this line, that is in high dose propranolol has quinidine like membrane stabilizing effect. Not related to the mechanism of action, but it is important, sometime used in a or sometime asked in a MCQ. So this is about the beta blockers, mechanism of action of beta blocker, uses and important facts. Then the class 3rd, that is drug that potentiate or prolong the duration of action. The example is aminodacron. So its mechanism of action is something that it is an iodine containing compound and structurally related to the thyroid hormone, means it is having iodine in its structure, same to the thyroid hormones T3, T4 like. So it has a broad spectrum antiarrhythmic activity. Broad spectrum means it have multiple kinds of mechanism of action. It will act by two ways. First of all, it will block the potassium channel, and second, it will block the sodium channel. By blocking the potassium channel, it will increase the duration of action potential, and after increasing the duration of the action potential, it will prolong the refractory period and suppresses the abnormal automaticity. That is what we want. And by second way, by blocking the sodium channel, it will decrease the conduction velocity. This is another aim of our management. So this is the way drug that potentiate or drug that prolong the duration of action potential will work. Then we will come to the class 4th, that is calcium channel blocker. Examples are verapamil, diltiazem, nifedipine, and amlodipine. Okay, the mechanism of action of this calcium channel blocker are, they block the both activated as well as inactivated L type of calcium channel. By blocking the L type of calcium channel in both the state, it will decrease the calcium mediated depolarization. As it decreases the depolarization, it will decrease the conduction velocity and increase the refractory period. This is the way calcium channel will work. So these are the 4 classes. Yes, this, as you can see on the screen, this is the most important page that you have to remember or you have to follow. So these are the 4 classes we have discussed about the 4 classes. I will also tell something about the drug which are used against the myocardial infarction in the same video, because all the group of drug that we are discussing here in the myocardial infarction topic we have already discussed in somewhere else. So these 12 or 10 are the categories which we are using against the disease myocardial infarction. So first class is the antiplatelet drugs, second class antiemetic drug, third class anticoagulant, fourth class analgesics, fifth class ACE inhibitor, sixth class ARB, that is angiotensin receptor blocker, seventh class is aliskiren, that is the direct renin inhibitor, nitrate, beta blocker, statin. These are the groups which we have used in different other diseases like AC, ARB, aliskiren. These are the groups which we are studied in the antihypertensive, the nitrate, beta blocker. Now we have studied the beta blocker. Nitrate we had seen in the anti-anginal drugs. Antiplatelet, anticoagulant are also used. Antiemetic we will discuss it in the digestive system. So these are all the majority of the drugs we have already discussed. The last 2 are the therapies which we can use to the patient of myocardial infarction, that is the low flow oxygen therapy and reperfusion therapy. These are the pharmacotherapy of the disease myocardial infarction. So these are the groups. Just remember the groups and have some information about each group separately. So thank you so much. Keep studying, keep smiling.